Hi, my name is Claudia Escalante, and today I'm going to talk about acute Methotrexate induced crystal nephropathy. Definition: drug-induced crystallized nephropathies are secondary to abnormal accumulation of crystals leading to parenchymal renal injuries. Methotrexate, used to treat a wide range of malignancies, is one of the various drugs accountable in this particular condition.
It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. Chronic kidney disease is a broad term that includes subtle decreases in kidney function that develop over a minimum of 3 months. In contrast, acute kidney injury refers to any decrease in kidney function that happens in less than 3 months. Now, the kidney's job is to regulate what's in the blood, so they might remove waste or make sure electrolyte levels are steady or regulate the overall amount of water. And they even make hormones. The bottom line is that the kidneys do a ton of stuff. Blood gets into the kidney through the renal artery, and once inside, it goes to tiny clumps of arterioles called glomeruli, where it's initially filtered. And the filtrate, which is the stuff that gets filtered out, moves into the renal tubule.
Applications in medicine. Methotrexate-induced crystal nephropathy is characterized by acute tubular injury with scattered intratubular and interstitial needle-shaped, golden-brown crystals which are frequently arranged in annular structures. The crystals show bright fragrance under polarized light and are methylamine silver positive.
This place is known as the glomerular filtration rate, or GFR. In a normal, healthy person, this is somewhere around 100 to 120 milliliters of fluid filtered per minute per 1.73 meters squared of body surface area. This value is slightly less in women than men, and it decreases slowly in all of us as we grow older. One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidney start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephrons glomerulus. Immune cells like macrophages and fat-laden macrophages called foam cells slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1, or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts. And then those mesangioblasts secrete extracellular structural matrix. This excessive extracellular matrix leads to glomerulosclerosis, which is hardening and scarring, which diminishes the nephron's ability to filter the blood. And over time, this leads to chronic kidney disease. The most common cause of chronic kidney
Pros and cons. Pros. Methotrexate is the first choice disease-modifying anti-rheumatic drugs for rheumatoid arthritis. Cons. Methotrexate can cause liver damage, especially when taken over a long period of time. Methotrexate can cause lung damage.
causes, though, include infections like HIV,
Issues
as well
in
as long-term
Ecuador.
use of medications like NSAIDs,
In Ecuador,
and
there is a
toxins
great
like the
lack
ones
of
in tobacco.
statistical data. Therefore, it is very difficult to know accurately
Now,
the
normally,
prevalence
urea
and
in the blood gets
incidence of
excreted in the urine.
methotrexate-induced
But when
crystalline
there's a decreased
nephropathy
glomerular
in every
filtration rate,
region.
less urea gets filtered out, and therefore it has nowhere else to go besides the blood. And so it builds up in the blood, which is a condition called azotemia. Azotemia can cause general symptoms like nausea and loss of appetite. But as urea levels really build up, they can affect the functioning of the central nervous system, causing encephalopathy. This results in asterixis, a tremor of the hand that kind of resembles a bird flapping its wings, and is best seen when a person attempts to extend their wrists. Further accumulation can even progress to coma and death. This buildup can also cause pericarditis, which is inflammation of the lining of the heart. In addition, there can also be increased tendency for bleeding, since excess urea in the blood makes platelets less likely to stick to each other, and so there's less clot formation. Finally, in some cases, someone can develop uremic frost, where urea crystals can deposit in the skin and they look like powdery snowflakes.
Issues in Ecuador. In Ecuador, there is a great lack of statistical data, therefore it is very difficult to know accurately the prevalence and incidence of methotrexate-induced crystalline nephropathy in every region.
Potassium levels are particularly important, and normally the kidney helps with potassium excretion. In chronic kidney disease though, just like with urea, less potassium is excreted, and so more builds up in the blood. And this leads to hyperkalemia, which can be problematic because it can cause cardiac arrhythmias. Another key role of the kidneys relates to balancing calcium levels. Normally, the kidney helps to activate vitamin D, which then helps to increase absorption of calcium from the diet. With chronic kidney disease, though, there's less activated vitamin D, so less calcium is absorbed into the blood, which results in hypocalcemia, low calcium levels. As calcium levels in the blood fall, parathyroid hormone is released, which causes the bones to lose calcium. Over time, this resorption of calcium from the bones leaves them weak and brittle, a condition known as renal osteodystrophy. The kidneys also release.
Conclusion. Methotrexate-induced acute kidney injury is usually reversible and treatment is directed at volume repletion and alkalinization of the urine.
Let's talk about urine crystals. So urine crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like for example, hexagonal shaped stone. It's like cystine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cystine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can like say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember, uric acid, sometimes like gout comes into mind. And in gout, like the definitive diagnosis is to get joint aspirate, okay, to see these crystals. Okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cystine. Coffin shaped, struvite stones, the evil one.
That's all. Thank you for watching.